My name is Dr. Jagannadha Avasarala, and I'm from the Department of Neurology at the University of Kentucky Medical Center in Lexington, Kentucky. And on behalf of my co-authors, Dr. Saurav, who's also with the Department of Neurology at the University of Kentucky Medical Center, and Dr. Suresh Keshavamurthy from the Department of Cardiovascular and Thoracic Surgery at UT Southwestern Medical Center in Dallas, Texas, will be presenting as its lead author our soon-to-be published article in the Journal of Rheumatology, period. The title of the article is Point-of-Care Ultrasound with AI-Driven Diagnostics in Giant Cell Arteritis, Blindness Prevention on a Global Scale. We believe that POCUS, which is Point-of-Care Ultrasound, coupled with AI diagnostics, is the only way moving forward to prevent blindness secondary to giant cell arteritis. GCA is the most common autoimmune systemic vasculitis of adults who are at least 50 years of age and above, and who present typically with various degrees of acute or subacute, total or partial vision loss. Other findings in the eye could include field cuts, eye movement disorders, double vision, just to name a few. But it can also present with symptoms consistent with stroke, myocardial infarction, and aortic aneurysm, period. GCA is more common in women than in men, and about 20% of patients experience total vision loss because of lack of treatment or a delay in diagnosis, period. The average delay in diagnosis is about 9 weeks, period. New onset headaches, tenderness in the scalp, in the temporal area, vision impairment are classic features, but any new vision symptoms with or without headache, with or without scalp tenderness or jaw pain at age 50 or above must bring GCA into the diagnostic fold, period. Point of care ultrasound, also called POCUS, coupled to AI analytics for diagnosis and prompt treatment, is the only way to prevent blindness on a global scale. Not a single protocol exists for prevention of blindness that stems from GCA anywhere in Europe or in North America. GCA must be categorized as stroke of the eye to increase public awareness. It is estimated that by 2050, about 3 million are projected to be diagnosed with GCA, and blindness is expected to reach 500,000 worldwide attributed to GCA, period. A protocol based on prompt acquisition of data through point-of-care ultrasound linked to a cloud-based database or a data bank, and AI-driven analytics for instant diagnosis is the only way forward that is urgently needed to prevent blindness, period. In 2016, researchers and clinicians at the University of Sydney came up with a brilliant idea that chewing gum at a rapid clip could reproduce jaw claudication in patients suspected of having GCA, period. They succeeded in their effort and published their data on 2 patients in New England Journal of Medicine in 2016. And this goes to show that efforts to uncover GCA could take many routes, but in this modern day and age, the time has come to prevent blindness on a global scale, period.